Well, hello, and thank you everyone for joining us today. I'm Tina Freese Decker, the President and CEO of Corewell Health and the Board Chair for the American Hospital Association. In 2025, the AHA is all in on tackling the challenges facing healthcare today. And these leadership dialogue conversations are diving deep into issues for inspiration and action as we continue to make health better together. So today, I want to talk about an issue that seems timelier than ever: trust. Trust in one another, trust in our field, trust in our communities and our government is so important to what we do every day. And everyone should know that our hospitals and our health systems are a place for healing, no matter what, and that trust is critical. Yet we see over the past several years, public trust has been decreasing, not just in healthcare, but across the board. So with me today to give some insights into why this might be happening is Lynn Hanessian, who just completed a 28-year tenure as Chief Health Strategist for Edelman, a global communications firm, and has worked directly with a number of hospitals and health systems during her career. And we had the opportunity to meet last month, and I was just fascinated by her presentation and what she's seen. And then we also have Dr. Robert Trestman, who I call Bob, who is the chair of psychiatry and behavioral medicine at Carilion Clinic based in Roanoke, Virginia. And he also serves as a professor of behavioral medicine at the Virginia Tech Carilion School of Medicine. And he's also on the American Hospital Association board. He is passionate about helping healthcare professionals and emphasizes the importance of remembering that we are human beings. That's a great reminder, with limits, and it's okay to ask for help. So, before we get started, I would just love to hear from each of you about what you trust in today and why.
Well, I'll go first if you don't mind. So for me, trust is about this sort of sense of confidence. Do I rely on that person, that organization, that institution? Can I count on them to do what's right? And so having that connection is really important and influences how I operate professionally, and certainly how I operate personally, and how I take care of my family.
That's great. Thank you. Bob?
Well, in the same way as physicians, we are in a unique situation to bond with a patient, and they need to believe that we have their interests at heart, even above our own. That's core to what we're all about. And for hospitals and health systems to be seen as extensions of the physicians, the nurses, the other clinicians who are dedicated to caring for our patients. So their belief in us is paramount, because frankly, unless they trust in us, they won't be willing to follow our recommendations, and we won't be able to help them heal.
Yeah, it's so important. It's why I am so uh, focused on our mission, because it is really about what we do and what we say we do and those values that are aligned there. And that's what gives me that confidence and trust that we're going to continue to focus on the mission. So thank you for sharing. So Lynn, let's start with you and the Trust Institute and the Trust Barometer. Can you give us some just general background on the work and the research that has been conducted?
Thanks so much. To give you some framing around it, for about 25 years, Edelman has been studying trust. And we originally sort of wanted to get a handle on, what does the public think? How do they perceive sort of the pillars of society? How do they think about government, business, not-for-profits, and media? And what does that mean in relation to their behaviors? And I think, Dr. Trestman, you bring up a really good point. If people don't trust, they're not going to follow their doctor's recommendations. And we found that if they don't have trust in their health, what we defined as the health ecosystem, that includes the doctor, the hospital, the all of those factors that help them get into healthcare, they're not going to get their regular appointments. They're not going to get the kind of care that's recommended. And I deeply worry that that means they're going to turn somewhere else. As we've studied trust over the years, we've looked very closely at trust at different sectors of business, of industry. Healthcare is among the areas that we looked at, but we also want to understand, how do we build trust? How do we think about the implications of that? And how do we sort of, frankly, help to forge a more trusting society? So that's really been quite a journey that Edelman has been on.
And so this conversation is particularly timely because Edelman just released the latest trust barometer data last month. What are some of the key trends that you can share with us?
Absolutely. And I think um, I'm going to share some global trends because it's important to know that we're not alone. We're in a really interesting time, a difficult time, because what we've seen is really a rise in distrust in government, in business, across society. And even as employers, we've seen a decline in the last year, a decline in my trust in my employer, which is, if you think about your daily activities, your employer relationship is among the strongest. If we asked about spouses and loved ones, we'd probably find similar numbers. But what we know is there's fear. There's fear of globalization, fear of economic pressures, fear of change that's really, really set upon us. And one of the things that the key concluding point that we saw this year, and again, this influences what's coming into your health systems, that dialogue with the doctor, the dialogue with the nurse, the whole communities in which you operate, there is a lack of optimism about the future. There is also a real fear of being discriminated against across all of the demographics we look at. And there's a belief that the government and business has their self-interest and that it's not including me, and that our leaders aren't telling us the truth. So there's a real sort of intense worry, and we called it grievance this year, that we're not going to get a fair shake. And so that's really the finding that we happened upon. And you can see there's forces in the world in which we live that want to shake our confidence in one sector so that they can have an advantage somewhere else, and we're seeing it play out in the general public.
That word grievance really hit me when you presented that to us and we talked about it, and it really does sum up where we are. And it's hard to be optimistic, but those are the things we need to be focused on and moving forward. So, Bob, as you're listening to this, what do you see are the implications of this distrust as it relates to healthcare?
Well, I think it's really important for us to be aware that there is this level of distrust in the community and to think through very consciously how we can mitigate it. The words that come up, grievance, fear, trust, all are woven together. So we need to think through, what is it our patients fear? And there's the fear of pain, the fear of death, the fear of different kinds of morbidity. That's what we as clinicians are trained to focus on. But we now need to talk even more broadly about a range of other fears, because frankly, people can be afraid that even if we give them a recommendation, they may not be able to afford to follow it. So we need to think through with our patients the financial implications of our recommendations, what it means for their families. So we as clinicians, as providers of care, and as systems of care need to be very, very thoughtful about how to support our patients so they can trust that we're thinking through the implications of how we recommend they deal with their illnesses in ways that actually will benefit them globally, and not that we're just focusing on one issue that may compromise something else.
So, for both of you, how do we as hospitals and health systems help build that trust with our patients and with our communities and the people that we serve?
So I have some good news. While trust in these powers outside of us has really declined, one of the few places where we still have trust is local. My doctor, my institutions, my media. And so that gives us some hope. And I think, Dr. Trestman, you talked about things so beautifully. It's not just, Lynn, you have a diagnosis, here's your medication. The things you're taking into account reassure me that you're concerned about all of me, that it is you're understanding the context in which I live. And this is one of the few places where we have some defense, some opportunity to build trust, because that expertise of my doctor, more so than my CEO, is trusted. And so I think those places where we can lean into helping people to really understand all of those things, that we're seeing them not just as a diagnosis in a particular space, but we understand how that plays out in their whole lives, gives us an opportunity. And I think, the way you described it is so much a reflection of, I'm concerned about you, how you live, those hurdles that may prevent you from achieving all you want to achieve. And so helping the peoples and the communities that we serve to understand that that's so central. I think you mentioned mission earlier, so central to how we serve, that we have an opportunity to build that trust. Now, one of the big challenges is when your patients are coming in, they're not getting a reliable source of information. They're not getting the news. We're not hearing the kinds of things that, and we don't trust public authority. So we have to think a little bit more about our, not only our individual patient, but the role of our institutions in serving our communities and filling a little bit of that void.
What would you suggest related to that?
Well, I think, frankly, for health systems and hospitals, particularly hospital CEOs, take a look at your operations, your communications, your marketing, your public policy, all of your uh, external and internal engagement activities have to be aligned. They have to be communicating. You can't just assume that we're in silos anymore, where you've got your marketing team that's going out to bring in your patients, but your public policy folks are out there talking to your elected officials. We need to make sure that there's an integration, a communication, and frankly, a little bit of a willingness to share the occasional vulnerability. We have our authority and our expertise because we're doctors and we're anchored in science. On the other hand, having that opportunity to be human together with the people we serve can make a big difference.
That goes back to your quote, Bob. So I'm curious to know what you think, Bob, we can do to build trust. And I know you're also very passionate about all of our teams that work in healthcare. And so how do we not only build trust with our community, but build it with our team members?
There is an aphorism that is at least as true today as it was when it was first uttered, that people don't care how much we know until they know that we care. And how is it that they know that we care? It's by what we do, what we say, how we interact. And so I think hospitals and health systems are uniquely positioned to be an integral part of the community. In many of our communities, we are the financial driver, we are the main employer, and that gives us an enormous opportunity to think globally about the impact of care delivery to our patients, but also our clinicians need to feel supported and safe so that they can do their best to provide care to those in their charge. So, as Lynn just said, we need to think in a coordinated fashion. Silos can no longer exist if we want to thrive as a healthcare system. We really need to work in a coordinated fashion so that all of the information is shared. And it's really, really hard to over communicate these days. We really need, as long as we're on message and our message is driven by our mission to improve health and healthcare for the people we care for, that our internal folks, our employees, our colleagues know that we are doing everything we can to support them, to provide them the infrastructure they need to deliver the care they want to do and to deliver. Because so many of the people they're caring for are their neighbors in the communities in which we serve.
Yeah, I have to say, the one other real benefit from that is trust is built. When we look at a business or an institution, trust is built by how you treat your colleagues, your workforce, and seeing those folks, appreciating that. And I think that gets back to sort of this really integrated communication model. When I know, when your teams, when you're everyone from the person I see as I'm walking into the institution who may be at the information desk, all the way to the clinician, to the nurse, to every touch point, when I know that they have the confidence because their institution trusts them, engages with them, that radiates and rebuilds my sense of trust and my confidence. So it's a nice virtuous cycle. And I would not underestimate the power of being a little bit more public sometimes with your internal communications, whether it's using your spokespeople or knowing that as you said so well, Dr. Trestman, that the people who are your employees are also part of your community, but that then radiates out to their neighbors as well. And so I think that's an important place to be. And it's a little bit challenging when we think with respect and deference to our patients, but letting our hair down just a little bit helps people to understand. And that's sort of that a little bit of the genuine and authentic kind of engagement that people look for these days.
And Tina, if I may, as someone who serves on the AHA board with me, what do you think are some of the things that AHA members can be focusing on?
Well, we've talked a little bit about it. I have this view of a kind of a paradox. We have to over communicate and we have to over listen. And we have to show both of those in an authentic, vulnerable way to make sure we know we're really connecting with people. We're hearing where their fears are or where they are anxious or where they want to go in places and really understand that and then communicate it back and forth. So I think this power of communication is really critical. Also accepting grace, that we're going to make mistakes and we need to make sure we can continue to move forward and we have the best interests of people at heart. And how do we do that? It's always focusing on the mission. And then lastly, from the American Hospital Association, sharing and communicating stories are so important for us. Talking about stories in the local community about what you can do to help patients, to help people live a healthier life, those are really helpful as we drive those forward. As Lynn said, that local piece is critical. And then thinking about how do we represent ourselves well that delivers the trust and reinforces the trust in everyday actions. So I think we have to connect all of those dots and recognize that what we do is who we are, and we need to make sure we're delivering on that trust every single day. So Lynn and Bob, any last comments that you want to share with us, with the listeners?
You are so visionary in how you're approaching this, because I think it's a mix of both our storytelling and our storytellers. I know how deeply mission driven you and your colleagues are. Don't assume that the people outside of your institutions appreciate that. And that patient storytelling, and also those storytellers, those trust champions across your organization, can also be really powerful in illustrating really what you do every day and helping people to really appreciate and embrace your mission and know that they can trust you. And I think that the benefit of that ladders to all of your stakeholders. Don't ever underestimate the importance of that storytelling when it reaches your policymakers and your elected officials and your other community leaders, because they have very complex and difficult lives. And it's important to always get to them with those stories so that they can give you the kind of appreciation and policy framework that you need to thrive.
That's excellent. Bob?
Healthcare is performance art. We are only as good as the last act of courage and kindness that we have shared with the patient. And it's also an issue, just as you've mentioned, telling the stories, but not once, but daily, because we need to reinforce the sense of safety and building that daily sense of trust in us, both from the perspective of the community seeing what we do, but reinforcing our own sense of value and commitment. That can never, ever go stale.
That's fantastic. So thank you so much, Lynn and Bob, for your time today, for sharing your expertise. Every one of our hospitals and our health systems is here for their communities, despite the challenges that we all face, making sure that everyone has access to the care that they need and trying to build that trust every single day. And we're trying to build that trust with our teams, with one another, with our communities. And I think that the lessons that we've learned here about storytelling and over communication and over listening and connecting on a human level and really addressing it back to how we're serving everybody and not assuming that people know that our mission is at the forefront of everything that we're doing, I think is really great feedback for us. So thank you all for taking the time to listen to this leadership dialogue, and we'll be back next month for another good conversation. Thank you.